Cancer is a scary word, but it's important to check in with your body every now and again and know the symptoms, especially if you think you're seeing some warning signs. It's estimated that over 53,000 people will be diagnosed with some kind of oral cancer this year, and that over 10,000 will die from it. And unfortunately, men are twice as likely to get oral cancer than women. Early detection is key when battling cancer, but you can protect yourself by knowing the signs and symptoms of oral cancer and knowing the ways to minimize your risk. Oral cancer accounts for about 3% of all cancer diagnosed each year. While that number may seem small, it's still important to know what to watch out for, especially if you're male. In today's video, we're going to tell you what the symptoms of oral cancer are and ways to minimize your chances of getting cancer in the first place. Will my diet make a difference? Is difficulty chewing a symptom? Does sun exposure have anything to do with it? We're talking all this and more, so keep watching until the very end. Symptoms of oral cancer. Like all cancer, the symptoms can vary from person to person, but if you're experiencing more than one thing on this list, it's probably a good idea to get it checked out. Remember, early detection and diagnosis is key. The most common places for mouth cancer to occur is the tongue, the tonsils, the oropharynx or the gums, floor of the mouth, or other general areas inside the mouth. Other likely areas are the lips, minor salivary glands, and other places. Number 1. Mouth sores. This is one of the most common signs of mouth cancer. Do you have a sore in your mouth that just won't go away no matter what you do? This can also include a sore on your lip that won't go away either. If yes, then it might be time to follow up with this symptom. Another common sight is white or red patches on the tonsils, roof of the mouth, gums, lining of the mouth, or frequent mouth bleeding. Before we continue, don't forget to hit that subscribe button and click the notification bell so you never miss any updates from Bestie. Number 2. Pain. If you have consistent pain in your mouth or throat, that could be cause for alarm. This can also mean those mouth sores we mentioned earlier. Just a sore throat alone can be many different things, like the common cold or a throat infection, so you don't need to assume it's cancer right away. But if it's coupled with a few other things we're listing, go get checked by your doctor. Number 3. A growth in your mouth. A growth in your mouth means something like a bump or a raised area that wasn't there before. This can be anywhere inside your mouth. You could also feel a lump in your throat that won't go away. This could possibly indicate a tumor. Like a lot of cancers, a tumor is a common symptom and mouth cancer is no different. Number 4. Problems with your teeth. We're not talking about cavities here, we're talking about your teeth feeling loose without any apparent cause as to why. This can also go for those wearing dentures. They can be difficult to wear, or they may feel more uncomfortable than usual if mouth cancer is an issue. Number 5. Pain in your ears. You could also experience an earache as your ears are connected to your nasal passages and throat. If something's going on there, the ears could be giving you a warning sign. Even if you experience pain, you should not lose any ability to hear out of the sore ear. Sometimes the human body is a little strange and will give you an indication that something is wrong in a completely different part of your body than the one that's affected. Number 6. Abnormal mouth functionality. This could include difficulty when it comes to moving your jaw or your tongue around. You may have limited motion or experience pain when you do try and move. This can also mean you have difficulty chewing and swallowing. Difficulties and painful swallowing is common in those with head and neck cancers. A sudden change in your voice could also be cause for alarm. Our voices get deeper the older we get, but if you've noticed something strange happening with your vocal cords, it could be a symptom of mouth cancer. Again, many of these symptoms are linked to other issues like allergies, the common cold, or they could be an indicator of something else entirely. Only if you have more than one of the symptoms we just listed should you be concerned about mouth cancer. Causes and ways to reduce your risk of cancer. We just want to preface this by saying just because you've lived your healthiest life does not mean you're immune to getting cancer. Cancer can happen to anyone, but here are a few things that are known to up the risk of getting cancer and some things you can do to reduce that risk. Number 1. Don't smoke. Smoking holds a whole litany of issues from trouble with fertility to premature aging of the skin to cancer. It's especially common to see mouth cancer develop in those who smoke. Doesn't matter if you chew tobacco either, any way you consume it ups your risk of oral cancer. It's also important to be aware of secondhand smoke, as that can do harm and up the risk. Not to mention, going smoke-free will benefit your health in so many ways. Number 2. Cut back on the booze. Sometimes there's nothing better than cracking a cold one on a hot day. But if you partake in alcohol, you need to rethink your drinking habits. It's pretty simple. The more you drink, the higher your risk of cancer. Alcohol has been linked to mouth, throat, voice box, larynx, esophagus, liver, colon and rectum, and breast cancer. Drinking and smoking together raises the risks of these cancers even more. Number 3. HPV, human papillomavirus. HPV is a sexually transmitted infection that has been strongly linked to the development of oral cancers. It's generally discovered in your throat, on the tonsils, or at the base of the tongue. If you haven't already, talk to your doctor about getting vaccinated, as it can reduce the risk of oral and cervical cancers. Number 4. Maintaining a healthy weight. This one is right up there with not smoking. Having a healthy body weight is one of the best things you can do to lower your risk of cancer. Another aspect of staying healthy is not sitting around too much and being physically active every day. If you have to sit a lot for work, make sure you get up and move around often to give your body a break. Number 5. A healthy diet. There's probably not one list out there that doesn't have this point on it. Eating healthy is the best way to keep your mind and body healthy. We're talking lots of fruits, vegetables, and whole foods, and minimal packaged or processed foods. Speaking of a healthy diet, here's a video that'll help you choose a healthy diet that's perfect for you. Watch 17 superfoods you should make part of your daily diet. Now back to our video on 6 early signs of mouth cancer. Number 6. Limited sun exposure. Okay, the sun can be wonderful, it's true, and you can still enjoy it safely. The sun's UV rays can up your risk of cancer, but if you actively wear sunscreen and avoid tanning beds, then you should be good to go. The main type of cancer the sun is responsible for is melanoma, which is a form of skin cancer, but this can also affect your lips. So don't forget to make sure your lip balm has SPF protection when you're enjoying the nice summer days. Number 7. Good oral hygiene. Okay, you knew this one was coming. We're talking about the mouth after all. Taking care of your mouth and gums can keep you healthy and should be part of your daily routine. We're talking floss, mouthwash, washing your retainer, the whole shebang. Seeing your dentist at least twice a year can help with things like early detection if an issue does arise. Things that you can't control. Like we mentioned earlier, you can't fully protect yourself from the possibility of cancer. All you can do is actively lower your risk by implementing the tips we just listed for you and living a healthy lifestyle. Things like your age. Unfortunately, oral cancer risk does go up the older we get, with the average age of diagnosis being 62. Your sex is another one. Males are twice as likely to get oral cancer over women, although medical professionals are still unsure as to why. Other factors include your family history, ethnicity, and of course, your genetics. Do you have any of these symptoms? Do you lead a healthy lifestyle? Let us know in the comments below. We'd love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.